I'm going to call the meeting to order.
I think
We have a quorum, but because Jeff's calling in, we have to do roll call votes.
For whatever reason.
You all received the minutes. Is there a motion to approve the minutes?
So moved.
Okay, is there a second?
Second.
Okay. All in favor, and we'll have to do a roll call. Sabrina?
Aye.
Amanda?
Yeah. Aye.
Jeff?
Aye.
Aye. Minutes are approved. Next item we have is we have to appoint or have election of officers for the next year. Currently I'm president, Sabrina's vice president or vice chair. We're both willing to continue to serve, but if there's any other nominations from the floor, I open the floor for nominations. If there's no nominations, I think we need a motion to
Close.
to elect. You move to close nominations?
Yep.
But except that technically neither Sabrina or I have been nominated.
Oh. Well, never mind. I take
We
that back.
move to nominate Sabrina and Dr. Ryder.
I second that nomination.
Okay. Are there any other nominations? Okay, we'll take it separately. Those in favor of Dr. Ryder as chair? By roll call, Sabrina?
Aye.
Amanda?
Aye.
Jeff?
Aye.
And I vote for myself. Okay. And now, for...
Are there any other officers for the board?
No, just
those
the
two.
vice
Okay,
chair.
perfect.
Okay. Those in favor of Sabrina? Sabrina?
Oh, yeah, I'll vote for myself.
Okay.
Aye.
Amanda? Jeff?
Aye.
And I vote aye. Okay. So congratulations, Sabrina.
Congratulations, Dr. Ryder.
Congratulations. Thank you for your service.
Thank you both for serving.
Yeah. Okay, Board of Health appointee recommendations. The board met in executive session and went over 5 recommendations. And Becca, do you want to read the 5? Because we approved
Sure.
forwarding all 5 to the commission.
Yep.
Mhm.
I've got kind of a little summary here.
Mhm.
Let's see here. I marked it out, so I'm gonna unmark it out so I can read it a little easier. Okay, let's see. So first we have Mark Broker. Should I read their political affiliation?
I think you just read their names.
Okay.
The
Oh, okay.
Full information can go to the commission.
Okay, Mark Broker, Dr. James Swander, Kathy Camus, okay. Then Dr. Philip Scott, and then Brandon Guth, PA.
Well, technically, do we need to make a motion on this meeting?
I thought you were just gonna make a motion to send all 5 to
Send all 5,
the
yes,
commissioners without any
without a rank.
ranking of priority or.
Right.
I think Becca did a good job of identifying their political affiliations and their resumes. Tell us what, I think that's sufficient for what the commissioners were expecting.
Okay, so is there a motion to forward those 5?
So moved.
A
Second.
Okay, opposed? All in favor?
Aye.
Sabrina?
Aye.
So we gotta do votes. Sabrina?
Oh,
Aye.
that's right.
Amanda?
Aye.
Jeff?
Aye.
Aye. Okay, motion carries.
Take all those tomorrow.
Health officer report?
All right. Indiana is currently classified as level 9, high on a 13-point scale for overall level of respiratory illness activity. COVID cases, hospital admissions, and deaths were all at their highest during the week of Christmas, and they've started to come down since here and across the state. There were 3 COVID-related deaths in Wayne County during the month of December. COVID, I think it's interesting, COVID wastewater concentration is currently the highest it's ever been since the Indiana Department of Health started their wastewater measurement dashboard. And it's about 17% higher than it was at this time last month. The COVID across the United States is up 45%, but down 3% in Indiana. Wayne County, it's down 41%. Influenza, it's up 210% in the United States, up 300% in Indiana, and over 300% in Wayne County. So let's all get our flu shots, people. RSV is down 30% in the United States. It's the same in Indiana, but it's up 75% in Wayne County. The most common COVID variant right now is JN1, which is a variant of BA286, which was the most prevalent. It's interesting, and Dr. Ryder sent me an article from JAMA on this, that virus was able to change one tiny thing which makes it able to attack an enzyme in the body, acetylcholinesterase, which makes it much more effective than its predecessor, BA286. That said, this variant, this JN1 variant, which is the most prevalent now, is you're still well protected with the bivalent vaccine that we're giving everywhere and in the clinic. Only 17% of the U.S. population has received this, had received it as of May 10th of 2023. I don't know where it's at now, but the people that are mainly susceptible to COVID, particularly to grave illness and death, are people with pre-existing conditions who are unvaccinated, which unfortunately is a large group of people. So the virus keeps becoming more infectious, but it's certainly less deadly than when it made its initial appearance way back in olden times, December of 2019. And that concludes the health officer report, unless there are any questions.
And we're still giving COVID vaccinations at the clinic, so they're still
Yeah.
available.
Yes, and we're actually having our clinic for the county on.
Has there been any distinction between the effectiveness of the last batch of COVID boosters, which, we're doing Moderna because we don't have the capability of freezing the vaccine, versus Pfizer?
So there is actually I forget what they call it. I'm sorry, I'm spacing right now. They changed the way that the Pfizer presentation. So there's a change in the presentation the way Pfizer does their vaccines, and we are going to have Pfizer vaccines now. They can be refrigerated for 6 months now, versus the ultra cold storage that you're talking about. So that's something that we have the capability to be able to do. As far as the effectiveness, I don't know any difference in the efficacy.
Everything I read suggests that they're almost equally efficacious. So when people ask me about which vaccine, I've suggested either whichever one they can get.
I read an article months ago of comparing the 3 different COVID vaccines, and I remember that it wasn't remarkable between the 3.
So this last, if you have your last booster, is that expected to be an annual?
Yeah. Yeah, you can get an additional booster after 2 months if you have like an immune compromise situation.
Yeah, it would appear that this virus has ability to mutate itself, is what's going to require us to keep having probably yearly updated immunizations.
Why don't you go ahead and talk about it? I didn't touch on that in the health officer's report.
So Dr. Weaver, the state health commissioner, came and visited on Friday. She's doing a 92 county tour where she just visits every county. She comes and she gives some county specific information for all the different core health services that are specific to our county as compared to the state, and then some other counties kind of in our area. Kind of talked about how we lined up with the good and the bad. She answered some questions with local elected officials, community partners, and things like that. Dr. Barrett, District 56 representative, was there, and because he was involved with the legislation, he was kind of talking about things and how things came to be, and it was really cool to hear him talk about that a little bit more. And then our regional team was there, so there's 3 regions, more the central region. So there's a health services regional director and then a general regional director, and they were both there, so our elected officials were able to meet the regional team. You guys were able to meet the regional team, so that was really cool just to kind of network and talk to them a little bit. The state asked us to talk a little bit about what we're accomplishing now and then what we hope to accomplish. So we talked about the reason why we think our immunization rates are a little bit ahead are because of our mobile unit and then our after hours availability. And then we talked about our STD, STI testing, and the reason why we think that program is so successful is kind of because of Dave Wolf, our PA, and some of the initiatives that he has with Hep C treatment and the testing that we're doing out with outreach and in the community and things like that. And then the final success that we talked about was our fatality review team. So one of the requirements with Health First Indiana is fatality review with child fatality review, suicide and overdose fatality review, and fetal and infant fatality review, just to kind of figure out what is going on, what's causing these deaths, and then to try to kind of implement some change with that. And we have a well-established fetal and infant mortality review and suicide and overdose fatality review team already. So we talked a little bit about that and kind of how we're offering mentorship to the surrounding counties with those. And then some things that we talked about that we want to try to really focus on with some of this new funding is our paramedicine partnership with the Richmond Fire Department. And then we talked about trying to increase the available resources for tobacco and vaping education and cessation, and then also increasing some of our initiatives for student health, like education in the schools and then also potentially outside the schools in the communities and things like that.
I think one of the interesting things about this is the fact that, in order to improve the health of a community, you have to identify what the problems are. And some of these problems are unique by county. And for instance, she mentioned that Vigo County, one of their problems were people drowning, which is not a problem in Richmond. We have no big body of water. We don't have the Ohio River. So the way they were going to deal with that is teaching everyone in Vigo County that was age 7 or older to swim. But then that that's a unique thing that county has. However, there are a lot of things that are in common. Every county has problems with obesity, with smoking, and it'll be interesting to me if somebody figures out a unique method for these problems that really works, they can share that with the rest of us. The same way, if we find something that really clicks, that is a great program, we can share that with others. So I think that's one of the strengths of this is the collaboration between counties through the Indiana State Board of Health. So it's an exciting meeting.
Yeah, they're an awesome team. Very approachable and easy to just kind of talk to. They're not super scary, I guess.
Any more on Health First Indiana? Or?
Yeah, yep. So as far as Health First Indiana goes, kind of scroll down here a little bit. So since last time I saw you guys, I met with the council, and the required match from the county was $721,000 approximately, and they actually gave us $827,000, which is what we had created the budget out of for 2024. So that was nice, more than they were required to do, and kind of able to meet our needs. So that was exciting. We are currently working on reviewing some of the contracts, requests for proposals and requests for applications that other counties are using, that are a little bit more developed, a little bit bigger, for their Health First Indiana funding. So some of the other, so for example, Hamilton County is one of the ones that I'm working with. They have already kind of developed this request for proposal process where they have essentially people applying to be able to use some of their funding to partner and then go out and do this core service work within the county. And so that's something that really we're just reviewing what they're doing, reviewing their website, reading through their contracts, seeing if it's even anything that's possible for us to do. I've been kind of working with some other elected officials, department heads, just helping me look over those things to see if it's even realistic for us. I've been working with Reed Community Benefit, reviewing their needs assessment survey that they did in 2022 to kind of see some of those things that Dr. Jetmore is talking about, like what is it exactly that Wayne County needs? What are we lacking? Where do we need the services? What are the gaps? And so I've kind of been creating a list between that needs assessment and then what our core service requirements are to decide kind of how that stuff matches up. The Richmond Fire Department did request a little bit more money with their paramedicine contract, and I requested an updated budget from them because it wasn't clear. They gave me their entire budget, and it wasn't clear if they were requesting all of that from me or just a portion of that from me. And so I have not gotten that updated budget yet. So I just requested it again last week, so hopefully we can get that soon. Let's see. And then one last thing. So with the increase in our money from the council, or increase in maybe what I was expecting from the county match, I've been trying to kind of tweak some of the numbers from what the original budget was that we had for Health First Indiana to see if there's a possibility of decreasing some line items in Health First Indiana so that we can potentially put more of that money out into the community. So more to come on that whenever I have a better idea of what that looks like after I hear from the Richmond Fire Department. Things like that. You guys have questions?
And what
on
service
that?
are they providing?
Paramedicine, so that is like when there's a 911 call and it's not like health related or legal related, I guess. So it's like a social emergency or a mental health emergency. They have social workers that go out. Right now they have 2 and they're only able to service Richmond. And so our goal is to expand it to all of Wayne County. It's a little more than we anticipated originally, financially.
Well, we had talked about, it was considerably, they asked for considerably more money than they did initially. So we had talked about that we could either put 2 people for a year or 1 person for the entire year. Now, the appealing thing about having 2 people is when we get, the appealing thing about having 1 person for a year is when we get more money from the state with Health First Indiana, we'll have somebody that is experienced, has been out on these calls, knows the ropes, and they'll be able to mentor the second person. But I don't think there's enough money in the budget to put out 2 people like they originally had asked for. But I think that's much preferable than to putting out 2 people for 6 months and then having the program abruptly end.
Yeah.
So there'll be more on this next meeting.
Yeah. Okay. And then the 2024 ASAP immunization schedule was released in November, and so that is effective now over the health department. And so there were some changes that were made as far as contraindications and things like that. So originally, if you were allergic to eggs, you might not be able to get a flu shot. That's no longer the case. So there's been some updates to some of that information, some updates and just notes and schedules and things like that. So the RSV, the monkeypox vaccine, those have been added to the children and adolescent immunization schedule. One of the things that I noticed that was interesting was so there's 2 RSV, immunization and vaccination. So the immunization is the monoclonal antibody, which is the one for children. And then there's a Brisbo, which is the one that's indicated for women in their 3rd trimester of pregnancy, and then also for adults over 60. That one's also on the children and adolescent immunization schedule, and is indicated for adolescents that get pregnant. So originally I didn't quite understand that and almost reached out to the state and thought there's
What's the
something wrong
pregnancy
here.
indication?
Right, yeah. So if they're in the 3rd trimester of pregnancy, so that is able to be given if they're in their 3rd trimester of pregnancy, regardless of if they're under the age of 18. So I just wanted to kind of make you guys aware of that.
But you don't have the monoclonal.
Not yet, but we're
Because
not
that's been
on.
quite short supply.
We're not on allocation anymore in Indiana. So we've been told on Tuesday last week, so a week ago, we were told that we should be able to get it soon. Kind of not so great timing with it. We're getting close to the end of the season, but we should be able to get it soon is what I was told last Tuesday.
So if we get the monoclonal, I think we'd want to work with Reed and physician offices to really make sure that we're really targeting the high risk, immature, premature, or have
Yeah.
other health problems.
Originally, whenever we first found out about Bay Fortis, I had talked to Heather Doherty, who's their director of all their immunization programs with Reed, and they weren't sure if they were going to be carrying any kind of, like if they were going to carry the smaller dosage or the higher dosage. So I think I could reach out back to her and see if they ever ordered any, or if they were able to get any, or if they are giving it in the hospital or not. Okay. The pneumococcal vaccine, there was some updates with that. So PCV 20 is kind of the gold standard with pneumococcal vaccination now. So there were some changes made to the schedule there for both adults and children. And then just some things added to the appendices as well. We got some more information on the monkeypox situation and vaccines just in general. So what they've told us is that it is going to be available to us as much as we need, but we want to make sure that we're using it appropriately. So we just have to be in regular, consistent communication with the Director of Immunizations at the state, which has always been fairly easy for me to get a hold of him, so I don't anticipate that being a problem for us. Okay. And then on your purple tab here, this is kind of switching gears. I have an MOU from Ball State. So Delaware County is actually one of the counties that we service with our HIV prevention grant. And we, in the past, have done HIV, Hep C, and STI testing at Ball State. And so with the ending of the Heartland contract, I met with their director of their health center to kind of reword some of this language and make it more appropriate. Ball State has since kind of looked over it and made sure that they liked it legally, so I wanted to provide it to you guys. And they don't need it until the end of the month, so I just wanted to make sure that you guys had it so that I could get it back to them in a reasonable amount of time.
Who signs for us?
I don't know. I can look and see who signed it last year and let you know. I would imagine that it's Dr. Jetmore, but I can let you know.
Other questions about this?
No, I would say great job connecting with Ball State and getting this worked out.
Thanks.
Do we need to approve this? And then I assume does it have to go to the commissioners or? Ron, what the approval process on this? facility agreement.
But, sorry, I didn't hear.
There's this facility agreement with the Ball State.
I haven't seen it.
Okay. So you need to see it.
I recommend it.
Okay.
You usually need to see stuff.
And see it. And if you approve it, I
You
think
approve
we,
it subject to my review, if there's any. I'm sure.
yeah, subject to your review. And does it go to the commissioners also, or is this something just the department does?
I'd like to look at it.
Look at it and you'll know. Okay, is there a motion to approve this subject to review by our attorney?
So moved.
Is there a second?
Second.
Okay. Any questions? Sabrina?
Aye.
Amanda?
Aye.
Jeff?
Aye.
Aye.
Thank you.
You look good too.
Thank you. They have a new
Nice job, Becca.
Thank you.
Yeah.
They have a new administrator over there at their health center, and she is
Great,
wonderful.
great.
Yeah, really
Yeah.
nice. The rest of the documentation here is mostly just for your information. The tobacco cessation guidelines and little medication resource packet I thought was really nice and handy to look at. So I think this might be something that we start kind of using with people who bring it up within maybe the STD, STI clinic, maybe something that we provide at health fairs, you know, wherever we might find it useful. There's some information for monkeypox and kind of what our process will be. So that's something that requires state reporting and contact tracing and case investigation and all that. So that's there. And then I put the new immunization schedules in there for you. And then the pink section is the about the vaccination for monkeypox. And then there's a brand new Health First Indiana website. And that's what the yellow tab is our little scorecard, snapshot of our time to shine, I guess, on the website. So it's got our statistics there. I think we probably have seen most of these statistics already, but I think it's a nice visual, the way that they've got it on the new website now. So I wanted to get that to you as well.
God, I hate these numbers on the ranking.
I know. I try not to.
Although we're killing it on vaccination.
We are, yeah. And they mentioned that, yeah. When Lindsay came, or Dr. Weaver came, she was talking about how awesome we're doing with vaccinations.
That's great.
Yeah. Yeah. Upcoming, the only thing I wanted to mention is there is a point in time homelessness count coming up later this month that we plan on participating in. We have some coats that we got, and so we're gonna probably put together some hygiene packs, bring our coats. The state gave us some hats and gloves and things like that that people actually knit and crochet at the state and then send to us. So we'll probably kind of bring all the warm weather stuff, some hygiene stuff, things like that, and help with that homelessness point in time count. And that's all I have.
Any other old business? Any new business or comments? Our next meeting date is Tuesday, February 20th at noon. And I'd entertain a motion to adjourn.
So moved. Sorry.
Is there a second?
Second?
All in favor? Sabrina?
Aye.
Amanda?
Aye.
Jeff?
Aye,
And thanks for joining us, Jeff.
sure.
And I
Absolutely sorry I
vote
couldn't
aye.
be there first.
That's okay, thank you.
Hope all goes well with
Yeah.
the new baby.
They're coming home today, so we're excited. So,
Okay.
Good times. Enjoy.
Congratulations.
thank you.
Thank you, everyone.
I can't attend that meeting on February 20th.
Are we gonna hang up on Jeff? I'm gonna hang up, Jeff.
Yeah.
All righty.
I'm gonna
All right,
be in
bye-bye.
New Zealand.
New Zealand. Well, you can call in.
I think it'll be. I think
What
it's
time
on a
zone will
different
you be
day.
in now?
I think
You
it's
don't wanna
on,
talk to us in the
it's on
middle of the
the,
night?
it's on the other side of the international date line.
Well, I think, Becca, we can look and see what's going on, but
Yeah.
we've had meetings without you, so.
That's hard to believe.
Yeah, it really is hard.
Has it been a struggle, Sabrina?
Yes.
I mean, there was mourning, weeping, gnashing of
Yes,
teeth.
Yes, yes. Lots of silence, lots of pregnant pauses. Wait.
Would you guys mind looking over this and just making sure your personal information is right? I had Jeff look over it already and he said it's right. But just addresses, no typos, things like that.
Mine was correct.
Now, the two
Yeah.
appointees, are they just filling the terms that are due up next year or in '26? What's the story?
I'm sorry, can you say that again?
The two vacancies
Mhm.
are for filling terms.
Well, Bob's term was not over yet.
Right. And I don't think John's was either.
No.
Oh, it
yeah.
wasn't? John's, I thought John's term was over.
No.
Let me look. I can confirm here.
So we're allowed to walk away?
No, you're not.
Hey,
I
don't,
thought this was like Hotel California. I don't know.
I mean, you can't resign.
Let's see.
You have a good reason. Technically, there was a rule if you missed 3 consecutive meetings, you were considered to have resigned.
Oh.
Okay, so Bob was until December of '24, and Dr. Eichelman was until, was until December of '26.
Oh.
Okay, so the one will be for 2 years, and the one will be for 1 year.
Yeah. I can make sure the commissioners.
so they will
They
fill
could be-
out the term, so.
They'll fill out the term, and then they would probably be eligible for reappointment if everybody agrees.
With the SEA 4 requirements, they're, like, the mayor has to get his appointment in, and I forget what the other one is, council gets an appointment. So it may be, unless they decide to reappoint the same people, so the way the mayor recommends 3 people to the commissioners, and so that would have to happen when there's a new term, and then the council just gets to outright choose someone. So whenever the SEA 4 says that whenever the term turns over, that has to happen.
So they'll be.
I think the
So-
commissioners are going to pass a resolution that'll identify the appointees whose terms will be subject to reappointment by the mayor. Actually, the mayor nominates 3 for appointment. Commissioners are limited to selecting from that panel of nominees. Other than that, then it's council that has one, county council. And they're basically going to, and take your recommendations, get you up to full speed with a 7-person board. And I don't know what that means as far as, who gets elected and what have you. And then take a look at the final roster of board members and terms expiring and make a decision then. It's not necessarily going to be the first expiring board members' terms. I hope the board members don't expire. But it's not necessarily the first vacancies that are going to get the council and mayor's positions.
I believe they voted on it in the November commissioner
Pardon?
meeting. I believe they voted on it in the November commissioner meeting on
I don't
how
think
to-
so.
oh,
There's
okay.
a resolution that was passed, and they didn't not vote on that.
Okay.
They just voted to fill Coddington's maybe
Okay.
until his term ends. But the resolution that would identify those positions and terms that'll be available to the mayor
Mhm.
and those that'll be available to county council, it's not been used.
Okay. Okay.
Ask a quick question.
Mhm.
So with what Ron's saying, one of these council will need to fill?
Yes, and it's kind of, so the
So
earliest.
is it the mayor's gonna do one and then we're gonna do the other one?
Commissioners will probably do both.
So the commissioners are doing these 2 for sure, these that are coming up. I know that Jeff told us that when we met with him.
Because that was before the law changed in January.
Right. Well,
Doesn't say how it should, doesn't say the law's silent on which positions.
On when, okay.
yeah.
And they're filling vacant.
I just wanted to make sure that I need to go say something to council and say,
Yeah, it's gonna be a while in the
Okay.
future.
See, Dr. Eagleman his position was expiring, I believe, in his term.
So his,
I know we had a-
No, it was
Yeah.
Connington expired.
2 years.
yeah.
At
No,
the end
actually,
of
he was,
December.
his term doesn't expire till 26.
Yeah,
Bob's expires at the end of 24.
right.
So you really have three, one's just,
And they
Rest
basically
this year.
reappointed the two of you who
Yeah.
are expiring on 23.
Yeah, after that, we're 25, 26, and 27 for expiring terms, so it would be a little while.
okay, thank you.
Thank you, everyone.
Thank you.
Thank you.